Hello, hello. Welcome back, everybody. Welcome back to the CAT Scan Guru podcast. Hope you guys are having an amazing week. Yes, we are in full swing of 2026, and I am fucking excited about all the good things that I have planned and the goals that I have just set up for myself, because I don't do the whole New Year's resolutions stuff because that's just not attainable for me. So, and I've tried that in the past, but you know what? It's just I would never accomplish the goal. So, have lots of good goals for me personally, and as far as my brands. So, because I have two different brands and just some other business ventures that I'm working on. So, if you haven't caught the last episode, I talked about the CT protocol book that I went ahead and created, and freaking fantastic. So, this is the first version of it. Of course, this will get updated as more things come out. So, make sure you check out the link in the show notes. It's available not only as a hard copy, but also as a PDF. So make sure you check that out. I'm super excited. It's one of the greatest accomplishments I have so far for 2026. And I hope it helps a lot of you technologists out there, because it's a really good resource. It's very general, so it doesn't stick to like one protocol versus the other. It's very general, so it could be just used anywhere. So make sure you go check that out. Also subscribe to the YouTube channel. I got lots of good educational content that's coming out. Subscribe to this podcast. Make sure you share it with a CT technologist that needs to hear all this, because they need to come and get educated. So bring yourself to the podcast show. And also make sure you follow on TikTok and on Instagram. So everything will be available in the show notes as far as that. So let's get into today's episode, where I'm going to be talking about learning CT without the overwhelm or burnout. Now, as a technologist, with the amount of years I've been in this is year number 23, you can experience a lot of overwhelm and burnout, whether you're a new technologist, whether you're a seasoned technologist. I know I feel the burnout now. So, and it's very overwhelming, especially when you have made this a career and you've invested time, years, energy, things like that, and just paid your dues to this profession. Okay. So I'm going to be talking about, the learning patterns, the core exams that I feel you should know, like in the beginning when you're starting out, and how to build your confidence. Okay, so we're going to kind of dive into these topics. All right. So, learning patterns when it comes to CT, I've seen different kinds of learning patterns. Okay. So, when I'm talking about learning patterns is when technologists come and they're transitioning from X-ray, or they're a student from a CT program, or even a traveler. You can kind of sense, how they perform, whether they learn something very, very quickly or they need more time. And I've experienced both of these learning patterns, because some people do catch on very quickly and some people need a little bit more time, because it can be very overwhelming. And then I've seen learning patterns where people just do not care. And I'm pretty sure you've seen that as well. And they just become what you call either a textbook tech or a button pusher. Okay. Now, as far as textbook, and that is nothing to be negative, but we're going to call it out as we see it, because that's what it really is. We are a profession, and you have to be the best tech that you can. And we want you to make sure that you are safely getting that exam done on the patient, not just because we have 30 ERs that need to be done and it's a conveyor belt. And I know it can kind of feel that way. Okay. So the thing is that we have to educate them the right way every single time. Okay. So people who catch on very fast, it's very good, but they also need to make sure that they have good structure and that they perform the exam safely and not rush through the exam because they want to pick up speed. Okay. Like, you have to make sure you do it correctly and safely. Okay. Next thing is that some other people do need more time. Sometimes understanding the why behind things. Sometimes is, why didn't my exam and the contrast enhance like I wanted it to? Or why did this happen? Or, the different types of factors of, what's going on. Okay, this anatomy is out of the field of view. How can we adjust and how can we fit everything in there? And sometimes that does need to be rescanned, because, we do have bariatric patients, and sometimes the anatomy that they're looking at can fall out of the field of view. So how do we correct that, right? So sometimes they need a little bit more guidance to really learn the core things that need to be learned in CT. And it can be very overwhelming and it can burn you out really fast. Okay, so sometimes people's learning curves are different. Now, as far as the textbook text/button pushers, okay, now, yes, you need the textbook material to learn everything on the registry, to pass the registry, to do this. I can tell you, when it comes to actually physically interacting with the patient, physically doing the exam, physically executing protocols, and physically, making sure that your patient centering is correct, a textbook ain't going to help you there. Okay. It's not going to help you there. It will help you for the registry and help you do that and become a registered tech. However, you need to know what you're doing when you're inside that room with the scanner with the patient and behind that console when you're executing that exam. Those are the things that you need to know, because you need to know what you're doing out there on the floor, not what a textbook tells you. Okay. And it's very frustrating because we do have seasoned people who teach the newer people, you just push this button, that button, this button, that button. Well, whatever you learn in your textbook. No, that's bullshit. You learn more when you're physically active in that setting and you are doing it, not watching somebody, when you're actually physically setting up the patient, physically doing the exam, physically administering contrast. That is how you learn the proper way. So we have to be mindful of different learning patterns with people as far as if they catch on quickly or if they need more time, and we can adjust accordingly. Okay. Now, the core exams that you need to know when you are first starting out. These are my recommendations. Whatever you guys do in your facilities, make sure you guys continue to do that. So this is my own personal perspective and what I recommend. So all your head CTs, make sure you know how to center them properly, execute them properly, angle if your gantry does that. I know a lot of newer scanners don't do that, because at my facility, we have 2 new 256 GE machines, and those do not tilt. Those gantries do not tilt. That you do after the fact. We do what we call a virtual gantry tilt. So, because those big bores those big gantries do not tilt anymore. Okay, they're stationary. So head CTs are very important. Okay, your stroke protocol, because especially with just the amount, whether you are like a stroke ready facility, you're a comprehensive stroke center, a primary stroke center, wherever the case is, make sure you know how to execute your stroke protocol, your perfusion, your CTA head and necks. Make sure you get that as a core exam tip top. Okay. Your abdomen and pelvises. Those are a scan that are ordered routinely every single day. Yes, I know they're fucking boring. However, that is a routine exam that gets ordered every single time. You see a head without, abdomen pelvis with. Usually it's on older patients that we see that combo sometimes, because they're trying to rule out some kind of urinary tract infection that the patient's altered and things like that, and can make them very, altered and confused. Okay. But you get it for a lot of other diagnoses as well on different populations of people. So make sure that you understand how to know your timing on contrast when it comes to abdomen and pelvises and things like that, and also CTA work. The next core exam that I feel is very, very important is your PE studies. PE studies are very, very important, and they order those like if you need a cup of water every single hour. Okay. I know that was a bad analogy, but PE studies, you have to know how to execute them properly. Contrast timing, knowing what that is, making sure that you're setting up your ROI in the correct place, making sure that your IV is checked properly, and make sure it's good for contrast injection, making sure, as far as how much contrast, depending on, patient habitus, cardiac output, which cardiac output, we really don't have much that we can do about that. But if it looks like a really crappy PE study, you know exactly how you can adjust it next time. Okay. So I feel that those are some core exams that you need repetition, practice, because repetition and practice builds your confidence, which is my last point in this episode. So when you have repetition, you practice those exams over and over and over and over again. And I know it's going to be repetitive. It's going to be boring. You're going to be like, oh my gosh, I'm bored out of my fucking mind. However, when you build that rapport where it's repetitive, where you practice a lot and you gain more experience, you're going to build more confidence in executing those exams. You're going to build more confidence when you center that patient correctly. Now, I talk about patient centering in every podcast episode, and I'll tell you why. Patient centering is very, very important when you do those scouts because it's going to tell that CT system the correct amount of radiation dose to give that patient. So when you center the patient correctly, it's going to calculate the correct dose so that we keep that dose as low as we can. Okay, so that is very, very important. And that is one of the things in every core exam that you have to make sure you do properly. Not the second time, you do it right the first time. Patient centering is very, very important. So laser light, please use them. Okay, that is what you need to do. Okay, so like I said, repetition, practice, those are going to make you a very confident tech. It is going to build your confidence in making sure that you can execute that. Like, okay, this is no problem. Because once you repeat it so many times, once you practice, once you get the flow of it, it's going to come naturally to you. Okay. And sometimes people with different learning patterns, yeah, that might take time, but eventually they start to get into the rhythm, get into a flow, and everything comes naturally. So my course that I've constructed, it is a course with three or four different courses looped into it, gives you this structure in CT that CT schools do not give you. Okay. And I am not knocking any CT programs or anything like that. However, I've seen curriculums and it could be structured a little bit different. So that's why I have created an entire just CT course where it is 3 different courses in one huge course, and it gives you the structure that CT programs didn't. So make sure you check that out in the show notes because it's linked in there. Okay. So that is it for today's episode. So hopefully this was insightful and gives you some clarity on how to just learn CT without the overwhelm, without the burnout, so you can be a successful tech. So thank you so much for joining me in this episode. Make sure you subscribe to the show, subscribe to the YouTube channel, follow me on TikTok. So I appreciate everybody listening, and thank you for joining me on this episode, and I will chat with you guys in the next episode.